Hello and welcome. You have joined the Pitch to Partner series from Care Transformation Studio. This series is about implementing new technologies inside the four walls of healthcare. A little bit of background about what we're going to talk about here, and I'm going to introduce my friend Becky Fox. We are going to talk about just how hard it can be to introduce healthcare technology in today's climate. It's complex, it's difficult. We have economic constraints. We have providers that are trying to balance regulatory pressures, cyber threats. We always have quality and safety first and foremost. We have workforce burnout, and then really finding new talent as we have talent that's turning over. All this is taking place while we're also trying to justify ways to use technology to bridge some of these gaps and bring in new innovation where there's an ROI and there's a clinical benefit. And most often, new healthcare technology does not have a demonstrated reimbursement or a history of tangible ROI that allows us to really build a sound business case. So we're going to spend some time talking about some of those nuances, some lessons learned, some things to look out for. And hopefully at the end of this session, you'll have learned some new nuggets to help in your journeys. So without further ado, I want to introduce our guest today, Becky Fox. Becky is the Chief Clinical Information Officer at Intermountain Health. Really happy to have you with us today, Becky. If you would just share with our audience a bit about yourself and your background.
Sure. So it's great to be with you, Amber. I really appreciate the opportunity to spend some time talking about this important topic and just to share a little bit about some insight from my experience in working in healthcare IT. So my background is a nurse. I've been a nurse predominantly working in the emergency medicine space. We often joke you can take the nurse out of the ER, but you can't take the ER out of the nurse. So I have really enjoyed that clinical kind of background that has allowed me to really hopefully run hard and fast at some technology and be a chief clinical information officer. What I do in my day-to-day job is really work with other leaders in our organization to set the strategy and vision of how we use technology. So whether you're a nurse at the bedside or perhaps an office assistant or perhaps a surgeon, a pharmacist, a lab technician, a dietitian, we really, work together to help make sure that our technology is seamless, easy to use, always striving for optimization and adoption, and making sure that it most importantly brings value to the caregivers, to the patients and families that we serve, and most importantly makes an impact to our organization and the community.
That's fantastic. Well, let's jump in. I've got our first question that I'll tee up for us, and sure. Look forward to hearing your insights. You've got great background and experience, and to bring the clinical care aspect to it is going to be so valuable for those listening in. So, what have you found, Becky, is really required to create a successful environment for clinical innovation? Is it environmental factors, market trends, culture? What really creates that successful environment for clinical innovation?
So to me, clinical innovation can't occur. It will not occur unless you have the right culture and the right mindset and the right involvement of the right people. So a lot of rights in that mix. But what it means is, whenever we look at a new type of technology or a new process or a way of doing things, what we really have found to be successful is bringing in all of those that are directly impacted. So when we implement a new technology, having bedside nurses, having clinicians that are going to be using the technology involved in the design and process is really instrumental. And then making sure you have the right culture to listen along the way. Because there's just some reality. I might bring a great technology to a bedside nurse and say, hey, I really need you to use this. It's going to be great. And if they tell me that it's terrible or 20 reasons why it might not work, instead of taking that personal or saying, no, you still have to use it, you really need to listen to that. And so that goes back to the whole having, from the get-go, having the right vision of how you're going to be an innovative culture and organization, and really having those conversations. So it's one of the things that we've done at Intermountain. We have a long legacy of doing that, and I'm pretty sure we're going to continue that into the future, where we really have that right culture and mindset, being curious, creative and always listening, involving the right people along the way, making sure that everyone's centered on, hey, what is the goal that we're trying to obtain? And then continuing to push forward and make changes and make things better. That's our goal whenever we adopt or look to adopt any type of technology.
I love your emphasis on listening.
Yes,
and
absolutely.
having the representation around the table. I would supplement and say to those who are representing the third party, the startup, the technology company, when you are in the courtship, when you're prospecting and you're building the relationship, even as early as that stage, having the diverse representation around the table and getting to know the clinical partners, whether it's physician, whether it's nursing, having your informaticians at the table and your IT folks as well. It is so important as early on in that courtship and relationship building to start having those representatives at the table so that they're walking along with you and you're hearing it as early as you possibly can, because they will ultimately be the salespeople for that technology and those who champion the buy-in, or the adoption rather, with the patient or with the physicians, whomever, is your ultimate customer with that technology. So I love the listening, and I love how you guys emphasize bringing in those partners early on. That's great.
Yeah, absolutely. That's what I found with some of the companies that we've worked for in the past. It's those that really listen intently, that really are seeking to understand how things work, why it might be a little bit different at one healthcare organization versus another, and really going into any type of partnership with an open mindset. That's what I have found is really valuable. It was really interesting. I was just at a conference recently and got to meet a lot of new startups and vendors. And I'm really excited, that space has changed a lot in the last 5 years. 5 years ago, some organizations would not consider investing in or partnering with a new startup company. And that's just not the way things are, at least at our organization. We are willing to partner with, to learn, to consider implementing newer technology or newer companies, because we also know that there's such an appetite to run fast. And, that's the cool thing about startup companies is they typically are much more agile than you might find in a larger organization. So there's a lot of things you can learn along the way, both for your organization, and you can put some really cool stuff in place. But one of the things that was interesting is at this conference, there was a person who was somewhat giving me a pitch of their company, and they said, I've never really worked in this healthcare space and I don't really have a lot of insight. And so it's just interesting. We always expect our vendors to be truthful, but sometimes I would say, I don't know, maybe we should go and spend some time, learning a little bit more about the environment and the customers that you might be potentially working with to really understand that space. And so listening is just a big key strategy in being able to do that. And it's what I've found to be successful. I did a few years ago get to dabble a little bit in the startup aspects. And so it's really interesting to be on the other side of the table, trying to, talk to potential clients. And that's what I found to be really successful, is just listening is a key core competency that you must have if you're going to move things forward.
Great advice. Seems so simple, right? And yet we really have to be intentional about it. Okay. Next question. If you could tell the vendor, the third party, the partner, one thing to do differently during the courtship phase, and we've talked about listening and how important listening is, what would that one thing be that they're doing today that you would say stop doing? What is the most common mistake that you're seeing or you're experiencing when you're interacting with vendors?
I would say probably the biggest thing that I've seen is just sometimes there's a lack of transparency. And what I have found is that, might be a new startup company that wants to create an illusion of being something that they're not. And sometimes that, the truth somewhat finds its way, its way out. And so one of the things that I've really encouraged folks is it's okay if you don't have an elaborate dashboard of reporting information. Let's not act like you do if you really don't, or you don't have the team to build that. That's fine, because maybe we do internally. And that's, again, how we would be better partners. So one of the things that I have appreciated in really good vendor partnerships is just having that transparency of what they can do, what they can't do, what they might be willing, to dive into a partnership with. And then that transparency and openness is what I've found creates a better working relationship.
That's great. Again, it seems so easy, and yet we encounter, the opposite experience. So transparency, being honest, and look at that as an opportunity to collaborate together and build together. It could be really fruitful for both. How long does scouting, selecting, and the contract process typically take? You've worked in a few different organizations, and as you said, you've also been on the other side of the table. What has been your experience of how long this process takes if you're helping that startup company, a partner, trying to really understand the length of time and the commitment of going through a selection process and the contracting stage?
It can really vary. That I think that's the hardest thing for vendors sometimes to understand, of exactly how many iterations they might have to go through with their sales pitch to get the right folks to the table. It also depends on what value that they're bringing to the table. What's the need of the organization? So what I have found in my experience is that vendors may come with a solution, but if we already have a solution in place, that's a different evaluation than if we absolutely have a gap. It also depends on what the true ROI is. If there's a financial, a patient quality safety, a regulatory need that's really driving, and you have a solution that you're going to bring to an organization that's going to target any of those aspects and can very quickly be implemented, those are going to get you a shortened life cycle to get to a closed sale and an implementation. It really just depends on the value that you're going to bring to the organization. I would say, even, a few years ago in the pandemic, things ran really quickly because there was an immediate worldwide need to get to everything from telehealth solutions to better supply chain to management of teammate caregivers. So it really just depends on what that need is. But organizations can run fast. It also depends on what due diligence you bring to the table as well. So for example, if I'm talking to a vendor and they have done the same implementation at a like organization across the United States, then bring us those success factors. Here's how to implement. This is how we can make your life easier. Here's, sample contracts. This is sample training materials. Those are the type of vendor partners also that we will say, they're here to make my life easier. This makes the entire process easier, and I can run with that. Sometimes it's a little bit harder for newer startup companies because they might not have, 5 clients that they've implemented and 6 months of ROI, and validation. So sometimes those things can make an impact to that timeline. So unfortunately, no clear answer. I wish I could say, it's 3 months. That's what it always is. But it really can vary depending on the need of the organization and the technology and solution you're bringing to the table.
And it's great, too, that you referenced the insights from past implementations and clients. One of the things that I experienced when sitting in the selection seat is the presentation of use cases that represented markets and systems that did not look like mine. So not all healthcare organizations are created equal. And I do think it's important for those partners, those vendors, to do the research, as you earlier suggested, on who are you talking to, right? And what does their market and their patient population look like? What does the payer mix look like? Because if it's a system that's the payer and the provider, and you're presenting to a completely different structured organization, and it's a small community health system that doesn't have any sort of plan, and they're not doing any payer work, that use case isn't meaningful to them, and they can't look at their own projections the same way. So it is important to listen, like we've talked about, do your research to understand who you're talking to, and then to some degree curate what you're presenting and sharing to justify your technology curate it to what is meaningful and relevant to who you're speaking with.
Absolutely. I think, one of the other mistakes that sometimes startups make is just realizing you need to, every interaction that you have with healthcare leaders and or organization, that might be your last opportunity. So you've got to make sure that any interaction is a meaningful interaction. So perhaps you have a meet and greet, first introductory meeting, but you really need to be prepared when you come to that meeting. Here's the ROI. Here's the estimated cost. This is where I've done it before. That's really what people want to know. Where have you done it before? What's in it for me? And what's the cost going to be? So cost meaning the time, the due diligence, the actual cost. How do I support it ongoing? And then, as I always say, how are you making my life easier? That's really what you want to, if you want to get a strong supporter, that's really what you need to answer. And that'll help you move along.
How far in advance do you typically start thinking about a scout and a search for a new technology for a solution?
It really depends. So, for example, we will have some products and technology that are on a cadence. So, for example, if we're going to, we have our acute care beds, for example, might be replaced every 7 to 10 years. Typically, that's about the life cycle of any technology. Some technologies you can extend to 10 to 12 years because they're pretty hefty, expenditures or investments. But typically, some of our technology there will be an evaluation process that will start at around year 8 or 9 for a reevaluation to say, hey, is this still the market leader? Do we need to go and replace this technology or not? Do we need to go do an inventory of what's on the market? What are the trending aspects? And then how do we move forward? There are some other aspects of technology that an organization might put on a staggered cadence, meaning we're going to replace our beds every 2 years, meaning this hospital gets new beds in 2024, then 2026, then 2028, et cetera. So it just really depends on how mobile the technology and or, device might be. It also depends on, what's the life cycle of that. But anywhere from a year to 2 years in advance is depending on the size and the scale of things, we might look at something. Now, again, I always enjoy what we call conference season because you get to see new technology, you get to hear from new vendors, you get to see some and hear from other leading organizations that are trying out some new things in technology and innovation. And so I do find that if you find something really cool that hits the market, you might run real fast at that and say like, hey, this is going to have a significant ROI. And so we're going to take our typical life cycle, or perhaps it's a new piece of technology that might replace it. I'll give you an example. I just recently talked to a device manufacturer who thinks that they can take vital signs in a new way. I'll just leave it at that. There's something as simple as vital signs, but that's something we do on a daily basis. It takes time and energy from nursing staff. There's a nursing shortage that's going to take another 10 to 15 years to try to recover from. So if there's ways that I can shave off 2, 5, 10 minutes out of a shift times all the number of nurses across our healthcare organization, that might be a piece of technology that I would want to quickly move up to the forefront. I wouldn't necessarily wait until 2028 and say, oh, that's when we're replacing the vital sign machine. So that's when I'll evaluate new technology. If there's something that is going to balance out the cost and investment with return on investment, then that's what we're going to kind of chase. So I know no clear answers on any of this, but hopefully some insight to those that might be working in the startup space. Definitely needs folks to be working in the startup space. That's where some of our best innovation and ideas come from, but just sometimes it seems like the never-ending battle to get your foot in the door. And there are ways to do it. You just want to make sure when you do, you're using your time wisely.
Such great advice. Thank you. Okay, this is our last question. What are you seeing? Okay, so what are you seeing as viable technology investments in today's climate? As you just came back from a big conference, what are you hearing as the common why behind problems that are looking to be solved from your peers in the industry? I'm certain AI was, all over the place, the most recent conference that you were attending, but is there something that's trending, a common issue or problem that really is standing out that you think is going to have great merit in the digital health and healthcare technology sector?
To me, some of the trends that we're hearing, of course, AI is in everything. It's going to be in everything. I think the biggest challenge with AI is really understanding how we're going to use it. So, for example, we know that we can leverage AI to pull up information about the patient, know about their history, and serve that some way to the clinical care team to have them be more informed about the patient. However, we haven't heard from vendors of like exactly how to go and do that. So that's a little bit of the challenge of how do you leverage AI in the workflow? And that's what I think will probably continue to trend and change over the next few years. We have organizations that have figured out how to do some of that, but we haven't necessarily heard that from the vendors per se. So that's what I think one of the things that vendors are working through is trying to figure out how can I go and meet with someone like Becky, as a chief clinical information officer and tell her, if you purchase this widget, this is how the nursing staff can now do XYZ. Here's our playbook for exactly how to implement it and how to collect the ROI on the other end of implementation. That's the kind of missing piece that we're not hearing from the vendors. And part of that is because everybody hasn't figured out exactly how they're going to use AI. There are a lot of promising aspects with regards to, I call it the modernization of nursing. So again, I'm a nurse by background, so that's always a big focus of mine. It's the largest group of employees that we have in our organization, and many healthcare organizations is nursing. And so there is a big focus on how do I make the work life of a nurse easier, better, faster, so that they aren't leaning to burnout, that they feel valued in their work that they do on a daily basis. And most importantly, we had removed that administrative burden that we've somewhat created in this electronic world. What I would say is that we need to have a modernization. Just because I've documented all of this information for 20 years, I'm not so sure that with all the technology that we need to continue to document those things. And so there is, and it's kind of a little bit of a double-edged sword. We've asked our vendor partners, or EMR vendors, for example, to create me a flow sheet where the nurse can document all these things. But now we somewhat say, well, I don't want the nurse to spend all their time documenting. So they've done exactly what we've asked them to do. And then there's also, of course, a regulatory component. We've asked them to do that because there's a regulatory driving aspect that's driving that. And what we really need to get to is saying, hey, there's all this great technology. Let's package it in a different way. Let's allow nursing staff to care for patients and document what they've done in a different way. And then this is the roadmap of how everybody can come together and do that. That has regulatory support, that has financial reimbursement in the right way, and that most importantly makes clinicians feel like they're really contributing to the overall care and outcomes of the patient. So that's my wish after spending some time with some other leaders talking about this, that I think we're on the cusp of a lot of really fast growing technology. AI is one of them. So the first aspect would be, how do we, improve the work experience of nursing staff in particular? The second thing would be, how do we improve the operational aspects of an organization with making scheduling and finding policies and doing educational requirements? And then the third aspect would really be around the learning process. Today we still have what we call old school manual processes where you sign up for a class and you go to a class and you have a virtual instructor or perhaps an in-person instructor. And there's value in having those in-person instruction aspects. What I would also say is there's probably some opportunity to leverage AI in the learning experience and the support experience a little bit better than what we all collectively do. So that's the third arm of that, or third leg of that stool. If we can fix the operation, nursing aspects, and then of course the training support, I think would be really key to healthcare systems and seeing some real big changes in healthcare overall.
Wow, that's incredible. In those three buckets, there's so much opportunity for technology to play a really purposeful role. So I'm excited to watch and see how the trends shake out and, what really bubbles up as capable, viable, and realistic to fold into the workflow. Because that's really where it gets complex, is that intersection of the technology fluently folding into that workflow, and where it can't, that's where the wheels start coming off.
I will share with you one of the other resounding themes that I've heard over the last few weeks and few months is really a shift in, again, back to that whole concept of having the right people involved in the process.
Mm-hmm.
So we've seen a pretty substantial growth in nursing, for example, being at the table of healthcare organizations, helping to set the strategy and vision of how we use technology. We've also seen a swell in the vendors, also including now chief nursing informatics officers, chief clinical officers in their organization, from product design to implementation to client management to sales strategy, et cetera. So to me, there's an exciting aspect and a shift. A friend of mine was asking me, he said, well, do you think it's nursing staff have been ignored? I'm like, it's not about ignoring any group of the population. What it is about really recognizing the value that clinicians that have worked at different aspects of a healthcare organization can really contribute to the strategy, the business mindset, and driving the organization's strategy and goals. So that's what I've really seen is a nice shift of having different clinicians involved in different ways. And that diversity of thought is what I think is going to be pretty significant in the next 5 years.
And that sparks me to share a thought. I highly recommend for the startup, the vendor, the partner, to ensure they have their own clinical advisement and guidance on staff as part of your organization.
Absolutely.
So as being a layman, I am not clinical. I greatly value and I understand what different type of thinking and questions come along with clinical partners being at the table and, a dyad or a triad type of grouping. And when you're working with a partner or you're receiving the pitch of, said vendor, it will be very apparent where there hasn't been clinical consulting along the way to build your story, to build the product. And those who don't come from a clinical background just can't think and challenge in the same way. And if you don't have that as part of your presentation, as part of the design of your product and part of the story of your services, and they're walking it with you, if you are not clinical yourself, it will come out and it will be a very difficult conversation and dialogue to be successful. At least it would be very challenging. So I highly recommend that you make that investment in having clinical guidance, leadership as part of your organization to build the products and services that you're looking to implement into that provider setting.
Absolutely. I think that's great advice, because you'll be surprised of, just like you said, what insight you can gain in talking to a clinician that might use your product. So whether that's a friend or family or reaching out to others to just say, hey, can I just run this by you and get some feedback? You'll be surprised when you make those simple asks of what you can and resonate. And of course, anytime you can invite clinicians to be on your board or advisory board or staff, I think that will be an investment worthwhile.
That's a great idea and a really great suggestion. Well, I'm going to bring us to the close of our time together. Becky, this has been fun for me. It's great conversing with you. You have such rich knowledge and insights, and I love how it's real, it's tangible. I thank you for what you have shared with us today. I appreciate your time. As we close out our episode, is there anything additional that you want to share or feel like that we didn't cover? I just want to give you a chance to close out any of the thoughts or insights that you may have wanted to share.
The last thing that I would say is just the value of partnerships with both the vendor space and also helping organizations connect. One of the things that we really learned in the pandemic, one of the good things that we learned and want to continue to bring forward, was just we all are in this together, this healthcare journey. And, if I figure out something with my team at Intermountain, we want to share that with the rest of the world. And we want the same to happen for others, so that we can not only replicate what we might have done in a quicker way, but we also want to be able to build upon. So I've joked with some friends of mine, that I've said, hey, I'm glad you're working on that program. And as soon as you have it figured out, I need you to write down those steps and then give me a call, so that if you figured out steps 1 through 10, I can pick up the ball at 11 through 20, and then we can continue to build upon that. But so that collaboration, and vendors can really play an important part in that, of saying, hey, let me connect you with so-and-so at this organization you may or may not know, but let's do some collaboration along the way. And that's what I think is the new trend that I'm pretty confident it's going to stick. It's going to stick for me because I'm always trying to connect with other people in other organizations, because we have to learn from each other. Time is too precious. We all have, it's the biggest commodity that we have to focus on, is how do we do things quicker and faster and in a better way? And the way to do that is through collaboration and partnership. And so I'm really looking forward to the collaboration and partnership that will continue today and into the future.
That is an excellent call to action. Thank you. I want to end us there because it could not be more perfect. Thank you, Becky. Thank you for joining us.
Awesome. Thanks.